So I want to just say that actually the morning here is an attempt at an unconference. So as opposed to a lot of formal presentations, the morning is structured really for us to get to know each other, to dive into some questions, get our brains going, and to open our minds to the possibilities of what the future might hold for us. The way we've designed this morning is, as I said, it's a little more open. And what we're going to do is we're going to just do some introductions and get the group sort of warmed up, getting to talk with each other a little bit. And we're going to have a series of kind of short presentations around some topics that are of interest and connected to the work we're doing, especially around sharing information and looking at other systems that have done that and have gone through major transitions. Importantly, we're able to do this work and bring people together with the support of a number of organizations every year. And we really want to acknowledge the support of, in addition to obviously Johns Hopkins University and the faculty that have contributed countless hours in preparation for this conference and this symposium, and will be involved for the next couple of days. We have some financial supporters as well. Esri, IBM, and the Stewards Foundation, which is a California-based foundation, are very significant, what we call champion-level sponsors. Without their help and without their support, we would not be able to put this together. I also want to recognize and acknowledge CGI and Public Consulting Group and Handle Technologies as supporters for this work going forward, and for this symposium, and hopefully for the work going forward as we look forward to that. So as you greet people and you get to know them, please express your thanks to their efforts and their support for this work. And I want to really very much thank you for the support that you've provided to us to be able to do this work on an annual basis. So who's here today, or who will be here over the time? It's an interesting combination of folks. I've mentioned to some folks here, between the state representatives, county, and federal, we have about 45% of the participants are here. About 24% are from industry, mostly from information technology. Academia, about 12%. And then this other category, an important other category, including nonprofits, association, courts, foundations, and individual consultants who make up the mix. So it's a very eclectic group of folks who are here. And just briefly, you'll see all the folks are in your packet in terms of individuals that are attending, but I just wanted to call out some of the organizations that are represented from the federal level who are either here or will be presenting over the next couple of days. I think we have 13 states that are in attendance or will be in attendance. I know there's been a couple of travel challenges over the last day or so from different parts of the country. We have representation from a number of counties, particularly from California, and you'll meet them along the way. Industry is represented, and we feel it's important, it's actually critical to have industry in the room when we're having these conversations. Because if we have the conversation without the partners that are building and implementing and integrating and helping us do this work, it's not going to get done. So having that conversation, and then of course, I think I should find another word for other. I apologize for that, but other thought leaders here, as you can see, are involved in the work going forward here. The goals. I think it should be clear, probably before you even got here, what we're trying to accomplish. One of the main things we're trying to do is expand the community that is passionate about interoperability. And we're starting to use this word accountable care community. And we're going to spend a little time about that, a bunch of time on that tomorrow. I think as I've been learning more about accountable care communities, which are an outgrowth of accountable care organizations and managed care organizations, it really represents the vision in some ways of what it is we're trying to do, which is to bring everybody involved in the equation, the health and the wellness and the disease management and prevention community all together. And I'll talk about that in just a moment. Obviously, we want to learn and share ideas and innovations and experiments that cross sectors and silos. And we want to identify new ways to leverage the Affordable Care Act to support efforts going forward. Obviously, from the show of hands before, you are all deeply involved with that. One of the things we've been talking about for a number of years while we were doing work at ACF and subsequently to that is that there's a window of opportunity that at this point in time expires at the end of 2015. And we have an opportunity to leverage those dollars and administrative flexibility in a way that is profoundly important And that without that knowledge and that drive for it, we're going to miss an opportunity to really take advantage of that. And we'll talk more about that. Tomorrow, we're going to explore the idea of personas. And the idea of personas has evolved, and we'll say more about it during the event tomorrow. But it's really it's whether or not you call it a use case or a case example. It's a more three-dimensional look at the consumers that we're talking to. And as Sid mentioned, it's the who that we're actually addressing. And as we've been investigating this, my experience in industry prior, looking at clients or customers, we did a lot of work on customer segmentation, trying to understand who our customer was. And this was I worked at Kraft Foods for many years. And this was back in the 90s. We had, at that point in time, 164 different categorizations that we could put consumers into, whether or not they were their age, their income, their geography, their education. And so we could divide the country up into the population pretty micro. And that was really a long time ago relative to the computer age. So I can't hardly imagine where the consumer packaged goods industry has gone, but you can all tell by what's showing up in your mailbox or your email in terms of the segmentation of that. And that's been taken clearly into the software development world. And as we've been learning more about that, really trying to identify who is the user of the products that we're creating, so that not only can we make sure that the interfaces and the communications is optimized and is working for the people who are using it, but how do we communicate inside our internal customers? Who is it that we're actually building these systems for? And how can we share that information? If we're building a child welfare information system that has to touch a medical system and a food nutrition system and a child care system, do the developers and do the program people in each of those programs know who that client is? And what do they look like? And what do they feel? And what do they want? Where do they live? And I propose that we don't have that vision today. We're all coming at it from a very narrow perspective. So this idea of personas is very intriguing, and we're going to explore that in some greater detail tomorrow. And then hopefully some inspiration, some recharge, and have some fun. And we may go back to the pre-Socrates idea of a symposium in the evening at dinner and at some of our receptions. And welcome back to the university. I like to think of these, if we've done our job right, you might feel like you've had a chance to, as opposed to retreat, advance into a little bubble of opportunity to think differently, creatively. I'm sure that everybody in this room has the word strategy in their goals and responsibilities in your job. Does anybody not have strategic direction for your organization in your job title or in your work? And so how often do you actually have a chance to sit back or sit on the front of your chairs, on the edge of your chair, and really think strategically? I know that I talk with people all over the country, and that doesn't happen very often. So I'm hoping that you give yourself an opportunity to really think about these kind of strategic issues as we go forward. Now, we've heard all about the tipping point. Well, I propose that, in fact, we are beyond the tipping point. I had a lot of fun doing that yesterday. And I think Apple probably has a better way of doing it on their product. But I really propose that we're beyond that, right? We're no longer at whether or not it's tipping. It's over. We're going, and the barrel is heading over Niagara Falls. And the question is, are we able to navigate that in some reasonable fashion and hope that we land safely and are able to make changes? Very briefly, interoperability. I suspect this room knows a lot about what that term is. Oftentimes people ask the question, well, what the heck are you talking about? Is it just computers talking to each other? And it's not. I mean, obviously the origins of interoperability, I think, come from the computer world, but it's the way we're using it and thinking about it really is much broader than that. It really takes into account the social, political, and organizational factors. The one example I like to offer here around interoperability is whether or not it's Expedia or Travelocity, and maybe preaching to the converted here. This is the perfect example of interoperability, right? I can go on, find a flight to anywhere in the country and get quotes from all of the airlines that fly there for the time I want to go, for the price I want to go. And they haven't had to ask, Travelocity or Expedia and those guys have not had to ask or mandate that each of the airlines creates or recreates their system to work from database, one system, right? They've been able to use NEAM and other data transfers to be able to gather the data, leave the legacy systems in place, capture the data, and then present it out to you as the customer. Now, granted, case management and child welfare and those kinds of things are way more complicated in many instances, but the basic premises, I think, help us think about the ability to do that. And as we've heard and we'll hear, technology is not the inhibitor here. It's how we focus it and how we move forward with it. There's a continuum, obviously. We don't start at interoperability. We start off working alone, together, collaboratively, and if we think about it on a continuum, I think that helps us sort of orient ourselves in our organizations as to where we're starting. We don't start at the goal, at the end. We know we need to know where we're starting from so we can build appropriate approaches. Years ago, when we first started this work and we started doing this graphic illustration, we realized that people learn differently, right? Not everybody learns through oral or through reading or through hearing or kinesthetically or by doing or writing, but all of these methods are part of how people take in information and embed it in themselves. And so what we try to do and we strive to do is to provide as many of those kinds of approaches. So whether or not it's lecture or it's conversation or it's graphic imagery or the recording of the messages so you can think about them later. The basic idea is how do we make thinking visual for people in many, many ways. And I do call out your attention to these some of these maps. These represent just a few of the landscapes and illustrations we've done. About 5 years ago, we did a national vision when we were at Yale with about 75 people to really look at where we're going. That's 5 years ago. We should go back and look at that and see if we've actually accomplished where that vision was set by a similar group to us here. We built a roadmap coming out of that vision. There's work here from the Administration for Children and Families. We spent 3 years working with them, and initially we did the same process to set a vision for the nation. It's Montgomery County, Maryland, and Montgomery County, Pennsylvania. You'll see some imagery, some consistent imagery around the room here, and this only represents a very small percentage of the maps. Part of it is to really begin to see the messages that and the issues that people are dealing with all over the country. We think about this work as, we all have heard the term no wrong door. Well, I think that's the concept we're moving towards, but it's more complex. It's not a two-dimensional in or outdoor. It's really a three-dimensional at least. So whether or not you come in from child welfare or mental health or substance abuse or the jails or wherever, our systems need to be able to configure to that individual and to be able to create a case plan and be able to address them. That's the vision we're moving towards. That's the no wrong door world that we're striving to try to help identify and articulate. And we've done that in a variety of ways. And this material is all in your packets, and it's on the website and stuff like that. But I just propose it to you, and won't go into detail here, is that we need a language, right? We've been hearing a lot about that. We need a common language that we can share and exchange ideas with so that we don't have to recreate the wheel every time we have a strategy conversation or a visioning conversation or where we're headed. Are we talking about policy issues? Are we talking about practice issues? What does it take on the ground to do this work? Are we talking about structural issues? Are we talking about information technology? Are we talking about business process? Are we talking about swim lane diagrams? When you have people in the same room, and we're talking about having technology people in the room with policy people and financial people, unless we identify what it is we're talking about, we're talking under or over or askance from individuals. So we've identified and talk about this in terms of a basic sort of theory of change. And we call that Human Services 2.0. It's really about this idea of a connected, coordinated future where we have this no wrong door approach. And we coined this term interoperability. How do we integrate and optimize the tools that we have in order to do this work? This is not easy work. All of you know that. This takes a long time to pursue in an organization. And then there's a change of leadership, right? So you just get yourself going and boom, there's a change and you head in a different direction. So how do you maintain that? Part of it is that language. Part of it is sharing the language and getting people involved. So what we've done sort of as archaeologists over the years, we had the opportunity to work with and learn from many systems that were doing this work across the country. And we kind of cleared away the detritus and saw what was actually important to those leaders who were able to make progress. And this is not probably, completely thorough, but it is an approach that we think has a way of creating this language. And as you've seen, we've identified 10 change drivers, from funding to public will to confidentiality, information sharing, to building open and inclusive systems, to customer focus, to bridging service silos, to data and management, to technology and workforce, leadership, each of which is a discipline and a domain unto itself. Each of those are, in a sense, our levers as we go through this work. And we need to understand where we're at. What are our capabilities? What are our competencies around these things as we go forward to build this, I like to use this term, the skyscraper of interoperability. We want to know what the ground is. We want to know which way the wind is generally blowing. We want to know if it's flooding. And I propose that we need to understand these things. So we've created methods to be able to understand, to be able to research and to document this stuff. So as you go forward, you've got a baseline. You understand that where we're starting from, where we need to strengthen ourselves, and where we can grow from where our strengths are.